Hello everyone. So today's our topic is how a USA health insurance work. Healthcare in United States can be very expensive. A single doctor officer visit may cost several $100 and average 3-day hospital stay can run tens of thousands of dollars or even more depending on the type of care provided. Most of us could not afford to pay such a large sum if we get sick, especially since we don't know when we might become ill or injured or have how much care we might need. Health insurance offer a way to reduce such costs to more reasonable amounts. The way it typically works is that the customer pay an us from premium to health insurance company and the payment allow you to check risks with lot of other people enrolled who are making similar payments. Since most people are healthy most of time, the premium dollar paid to the insurance company can be used to cover the expenses of the relatively a small number of enrolls which who get sick or are injured. Insurance company, as you can imagine, such studied risk extensively and their goal is to collect enough premium to cover medical cost of the enrollers. There are many different type of health insurance plan in US and many different rule and arrangement regarding care. Following are the three important questions you should ask when making a decision about the health insurance that will work best for you. Where can I receive care? One way that health insurance plans control their cost to influence access to provider. Provider include physician, hospitals, laboratories, pharmacies, and other entities. Many insurance company contact with a specific network of providers that have agreed to supply service to plan enrollers at more favorable pricing. If a provider is not in a plan's network, the insurance company may not pay for the service provided or may pay a small portion that is put in a network care. This means the enroller who pay goes out of the network for care may be required to pay a much higher range share of cost. This is an important concept to understand, especially if you are not originally from the local Stanford area. If you have a plan through a parent or example and that plan's network is in your hometown, you may not able to get the care you need in the Stanford area, or you may incur much higher cost to get that care. What does the plan cover? One of the things healthcare reform was done in US under the Abnormal Care Act is to introduce more standardized insurance plan benefit. Before such standardization, the benefit offer varies drastically from plan to plan. For example, some plans cover prescriptions, others did not. Now, plans in the US are required to offer a number of essential health benefits, which include emergency services, hospitalization, laboratory tests, maternity and newborn care, mental health and substance abuse treatment, outpatient care, doctor and other services you receive outside of hospital, periodically service including dental and vision care, prescription drugs, preventative services, examples of immunization and management of chronic disease, rehabilitation services for our international population of students who might be considering coverage through important. Third one is how much will it cost. Understanding what insurance cover cost is actually quite complicated. In our view, we talk about paying a premium to enroll in a plan that is up from cost that is transplant to you. It is you know how much you pay. Unfortunately for plans, this is not the only cost associated with the care you receive. There is also typically cost where when you access care, such cost is captured as a deductible consequence and or co-pays. See definitions below and represent the share you pay out of your own pocket when you receive care. As a general rule of thumb, the more you pay in a premium upfront, the less you will pay with when you access care. The less you pay in a premium, the more will you pay when you access care. The question for our student is pay a larger share now, pay a share later. Either way, you pay the cost for a care or receive. You have taken the approach that it's better to pay a larger share in the upfront premium to minimize as such as possible costs that incurred as the time of service. The reason for our thinking is that we don't want to barrier to care such a high copay that the time of service to discourage student for getting care. We want a student to access medical care whenever it's needed. Important insurance term and concept. Out-of-pocket expenses. The term out-of-pocket cost and or cost sharing refer to the portion of your medical expenses you are responsible for paying when you actually receive health care. The monthly premium you pay for care is separate from this cost. Annual deductible. The annual deductible is the amount you each pay plan year before the insurance company start paying its share of the cost. It is deductible is dollar 2000, then you would responsible for paying the first dollar 2000 in the health care you receive each year, after which insurance company you start paying its share. Co-pay payment or a copay. The copay is a fixed upfront amount you pay each time you receive care when that care is subject to copay. For example, a copay of $30 might be applicable for doctor visit, after which insurance company pick the appraised plan with higher premium generally have lower copay, and vice versa. Plan that do not have a copay typically use other method of cost sharing. Co-insurance is a percentage of cost of your medical front from the MRI cost. $1000 you might be paid 20%. $200 your insurance company will pay the other 80%. $8000 plan which a higher premium typically has low co-insurance. Annual out of the pocket maximum. The annual out of the pocket maximum is the most cost sharing you will responsible for in a year. This is typically your deductible. What is meant to be a cover benefited? The term cover benefited and cover are used regularly in hence insurance industry but can be confusing. A cover benefit generally refer to the health service that is included. It is covered under the premium for a healthy insurance policy that is paid by or behalf of the enrolled patient. Covered mean in the some portion. For example, in a plan under which urgent care is covered, a company may be apply the copay as a out of the pocket expense of the patient. It is copay is $100. The patient have to pay this amount usually at the time of service, and then the service insurance pay cover the rest of the allowance cost of the urgent care service. In some insurance company might not paying any toward the covered benefit. For example, a patient has not yet met a annual deductible of $100 and cost of service provided. So that's all from this video. Thanks for watching. Please like, share and subscribe this channel.